Welcome to the What Paramedics Want podcast series of Inside EMS, sponsored by Pulsara. Whether replacing radio reports, alerting specialty teams, or managing mass casualty incidents, Pulsara simplifies communication, one tool every day, regardless of the event. Well, this is it. This is probably, let's start calling this the holiday editions, Kelly, of the Inside EMS podcast. I want to thank you for joining us. Chris Cebollero with me always, Kelly Grayson, KG. A lot of things going on, man. It's the holiday season. Halloween's over, getting ready for Thanksgiving. And then right around the corner, Thanksgiving's later this year too, Kelly, the 28th of November, 2024.
I celebrated a birthday a couple of weeks ago, and I'm in Montana currently for the Big Sky EMS conference, and came up here for Halloween, and I've been having a great time. There's a great bunch of people up here.
You dress up?
No, I didn't dress. Well, yeah, I came as the world's best paramedic, and I already have the wardrobe for it. So, I was.
Kelly Grayson, you're a real man, and that's for sure, boy.
That's right, baby.
One of the things that, we're always kind of on the march for shows and things to talk about. And you and I scour the internet for things to visit about. Yeah. And there were a couple posts, I think, that gave us or gave me, and I kind of brought them. I said, let's go ahead and talk about this. Yeah. But we'll have one on the end of the break. There was a discussion about honorariums at EMS conferences. And I think Kelly and I have a different take on this. Yeah. But there was one that I saw today that I just really wanted to talk about. And there was a discussion about nasal intubation and how nasal intubation should have never been taught and that it's dead, and people are commenting that it causes too much but then it makes you think about all these things that we did and what we didn't do, EJs and nasal intubation and digital intubations. But I just want to talk about some of those things because I thought they were really interesting. But Kelly, I've been babbling this whole time. I don't think you've said one word yet.
Well, but why should today be any different?
Any different? Yeah.
I disagree with the statement. Is nasal intubation dead? Yeah, probably. If not, it's close to it. I can't think of a time I've needed to nasally intubate someone, but never should have been taught it. Dead wrong. Dead wrong. We should have been taught it. It was an alternative device that we needed. Now, with the advent of CPAP, and we don't have to intubate conscious people anymore, and the classic nasal intubation was our failing CHFer, and you'd sedate them a little bit, give them some topical anesthetic, and squirt a little hurricane spray on the back of their throat and nasally intubate them, but we don't have to do that anymore. But before CPAP came out, yes, you needed a way to intubate someone, and it wasn't, oral wasn't always the way to go. Not every patient is like Tube Me Sheila. We used to have a patient named Tube Me Sheila that would call, and she needed intubation, and she would just man it up. She would open her mouth and grab the rails of the stretcher and just take a tube.
And you didn't knock her down?
No. Well, we didn't have things to knock her down back in those days. This was the 90s. Yeah, I mean.
Well, one of the things,
she could get two words out of her mouth. Tube me. Okay.
Here we go.
Her mouth went.
Yeah, that's gotta be freaky. But one of the things that I used a lot of times as well was digital intubation. I mean, and I hate to say it like this, I would practice those skills. Right.
Yeah, so if I do it too. That's the way I impress the hell out of my paramedic students. Oh, you're having problems with intubating them? Here, well, let me just do this. And I would digitally intubate the mannequin, and they think I think it's important that you think your instructor has some special voodoo that the rest of the human race doesn't have.
The voodoo that you do, let's do that voodoo that you do.
That's right.
Name that movie.
That was Blazing Saddles.
Yeah, good. So, but yeah, I mean, I've done digital intubation before. I put a bite block in between their teeth because they will bite. And I've gone in, you could feel the vallecula, man. You just drop that tube right around your fingers. You can use your middle finger to guide that thing right in. We are talking about nasal intubation. and or digital intubation. And that was always the fail-safe for me, man. And I used to make the comment years ago, Kelly, there is no reason a paramedic should not be able to intubate somebody as long as we had digital intubation.
Yeah. I have, fun fact, I have successfully digitally intubated as many patients that have nasally intubated.
Just two.
Yeah, just two. I take that back, three. So actually I have nasally intubated more people. The worst one was a kid, July the 4th, 1997, who
So
was
you
Tristan.
remember this call?
Hell yeah. I saved the kid's life and he sued me.
Okay.
Could not, it was literally a blind nasotracheal intubation in a non-breathing patient, so totally blind, didn't have anything to guide. I nasally intubated him. And when I got to the back of the throat, I ordered my helper in the back of the truck to do chest compressions and force enough air out of his chest for me to guide the tube. But on two different occasions, both in very difficult, challenging situations where there was no way I would have been able to visualize vocal cords, one in a structural collapse and one in an overturned log truck lying in a ditch where the guy's face was about this much out of the water. Digitally intubated both those people.
And that's half of the people that aren't watching on TV. So,
Yeah.
I mean, you can't do visual jokes if we're not going to tell them what it is.
It's like, half of his face is out of the water. The corner of his mouth was underwater and he's blowing out trying to maintain his airway.
So was he stuck?
Digitally intubated both of those, huh?
Was he stuck or was he?
Yes, he was stuck.
Okay. So he was trying to breathe, but just from the corner of his mouth.
Digitally intubated both of them. The first one was lying on my back underneath the pilings of a house through a piece of the floorboard that they had sawzalled out. Some dude pulled a load-bearing wall down and the house pancaked on top of him.
So is that going to matter? Were you going to be able to inflate his lungs anyway?
He lived to the hospital.
I
can't help what happened after the hospital.
How about, did you ever use a Bougie?
Yeah.
What did you feel about that? What did you feel about that?
I've always been proficient at intubation. Some might even say arrogant and egotistical about intubation.
No, Kelly, stop. No.
What have I said a million times? I can fall down a flight of stairs and accidentally intubate people. Always been good at it, but it's foolish to just ignore a new useful adjunct just because it's not something you're used to. And I had to teach myself to use a Bougie because I didn't want to be like those people those old salty medics that say, I only use a stylet if I miss it the first time. Like, no, don't do that. If you got something that will make a first pass intubation more likely, it's foolish not to use it. So yes, I use a Bougie.
So I don't know we see them much anymore, but for those who don't know maybe what a Bougie is, it was kind of a 18-incher silicone type covered guide wire.
Freshman intubating stylet.
Yeah, with a little hook on it. And you were supposed to be able to send this in through the mouth and do it blindly and still you would feel the cricothyroid rings as you went through it. So that little hook would clink against the rings. Yeah. And then you would just put your ET tube on it and just kind of guide it in through the.
We still use them. They're commonplace still.
But people aren't using them. I mean, they may be on the ambulance, but they're not using them.
That is a training issue. If you're not proficient with all the tools in your box, what does that say about your training? People not using them. Well, that's on them.
But I think that one of the things that this conversation is steering me towards is we've had skills that we were able to do that we chose not to do, right? If we couldn't intubate somebody the regular way with a laryngoscope, we gave up on it. We just bagged them. Well, what about nasal intubation? What about blind? What about digital intubation? What about using a Bougie? And it's the same thing as that we're taught how to give IVs. And you and I were talking about this before we went live. And the same as you is my vein of choice in cardiac arrest was the EJ. I would go right to the EJ as they're doing CPR. That's the vein that's going to start to fill. And a lot of my peers would tell me that I was barbaric for doing it. And I would always say the same thing. If this guy wakes up, he can bitch me out. But I need to get an IV. And this is before we went to IOs, right? Which was remember we had the sternal IOs first.
Yeah, the fast
rather than going into with the drill, it went right into on the suprasternal notch. You would put
the manubrium.
There'd be a hole in it, and you would jack this,
That
introduce.
thing looked barbaric.
But you know what? I mean, it worked. And
It
I,
works.
I remember, we talk about this, we're kind of babbling going down all these rows, but I remember a rep actually drilling into his own leg with a
Easy IO.
easy IO.
I had an easy IO drilled into me at our training in service.
I mean, it didn't hurt, right? I mean, the pain
It
is
hurt like
really
an
when
IV. Now
the pain
caveat,
hurts with the infusion.
that will make you pull the sheets up your rectum.
Yeah.
That hurts. Legit, wave of nausea, pain flashed over me.
And that's where they would tell us to put it, use a little bit of lidocaine or whatever.
Lidocaine,
But,
yeah.
we had all these opportunities. We had all these things to do. And it was almost like we were just bread and butter, right? That we wouldn't do these things. I remember I was in my training phase when I was at MedStar, and my FTO says, I don't think we're going to get an IV. And I says, give me that 16 gauge, give me that 18 gauge. I'm going to hit him right in the EJ. But it's a skill that we need to be able to develop as we're going forward in our careers, because we just never know. I've done IVs on people in the back of the ambulance where I've stood at the head and I've brought it back towards the head just so I could practice on if I was, upside down in a car somewhere and I needed to start an IV on somebody. So anyway, I'm babbling. What do you got?
No, but I think statements like we should have never been taught it. That's horse manure. Everything, all vision is 20/20 in the rearview mirror. And when you look at back, you have to look at it with a historical perspective. We were never taught. We should have never been taught spinal immobilization. But with the information that we had at the time, it's best to do it as best we could. Now we have better information. No, we shouldn't be doing it. But to say that we never should have been taught it, and when there's a void of data that says it is harmful and there's possibility that it might be helpful, okay, it made sense to do it. And the same thing with nasal intubation. I could still envision scenarios today where nasal intubation would be appropriate for people. And just because we do it rarely doesn't mean that it's not something you should consider and have in your bag of tricks. And I take a lot of pride in having a great big deep bag of tricks to pull from. And I can't count the number of times that some obscure piece of knowledge or assessment technique or treatment technique worked for me in the field when everyone else had given up or not even considered it.
Yeah.
Be it digital intubation or tactile vocal phrenitis or auscultatory percussion or any one of a number of things.
But just because you have the tool in your bag of tricks doesn't mean you should do it unless you're not practicing it. And you have to be able,
that is
you
true.
have to be able to
these,
look for the opportunities and
yeah.
make the determination that this is a place for this skill and I'm going to give it a go. Let's go ahead and take a quick break, Kelly, and then we'll come back. And I want to talk about my other topic that I saw on Facebook about honorariums and presenter fees.
And now a word from our sponsor.
Pulsara scales to meet your dynamic communication needs. From routine patient alerts to managing large-scale emergencies, every responder and clinician connect seamlessly. Familiar yet powerful, Pulsara streamlines your response from routine transfers to regional disasters. It's one tool every day, regardless of the event. Discover more at pulsara.com.
Back on the other side of the break. We appreciate it. And so, Kelly, as I was, cruising the internet for topics, we both belong to a group, presenters in EMS, or, whatever the name of that group is. And there was the discussion about how conferences are not paying honorarium. And this was specifically discussion at EMS Expo. Yeah. And there were people who were really being negative against the opportunities of getting paid to speak at the national conference or to speak at other conferences. And you see that all the time. And it really is one of the things that fires me up inside, because I've been speaking since 1986. And I like to think that I'm a good speaker, and I like to think that I can entertain the audience and I can keep them engaged and I can keep them motivated. And to me, the honor of speaking at a conference is better than, or is not better, but it gives me an opportunity to hone my skills. And that's what's led me to grow a business outside of EMS to where I can charge people an arm and a leg for my services. But I know you have a different opinion, so share your opinion. But I'd like to get into a little bit of debate about this.
Well, the ability to educate people at the same time entertaining and keeping them engaged and eager to learn and keeping them motivated. There's an art and a skill to that, and not everyone has it. That is a skill set.
Yeah.
And to me, doing that is I am a professional at doing those things, and professionals get paid. Professionals get paid. Now, I determine my worth. I determine how much I should get paid, and I have a set honoraria, but I am not mercenary in that, hey, you're going to pay my fee or I'm not going to show. But I think I have, I'm not going to hold up a small, struggling EMS conferences trying to get off the ground for money. I expect to get paid, and I don't want to go in the hole to speak there, but I'll cut them a break. If having Kelly Grayson at their inaugural conference, puts butts in seats, I'm not gonna charge them an arm and a leg. And many's the time, we were talking about that today, and I've made some hunting contacts here in Montana that I've spoken at EMS conferences for hunting privileges and like, hey, take me pheasant hunting, take me caribou hunting, take me trout fishing one day, and I'll cut you a major discount on the honoraria.
And actually, you
But
and I did this.
professionals
You and I
get
did
paid.
this in Oklahoma this summer. I mean,
Yeah,
with our friend John Purrier, with Chris Albright.
exactly. And we
Yeah,
basically did the conference for them and gave them a great deal on it. I think it's disingenuous as a conference organizer to ask professional EMTs, professional educators who have worked hard to perfect their craft to do it for free. Sorry.
yeah,
No,
but I think that one of the things that we have to be able to look at is again is to speak and speak effectively. It's hours and hours and hours of preparation. It's hours and hours and hours of planning. And where are you going to gain that knowledge from? Where are you going to gain that skill from? So if I'm going to go to a big national conference and they're going to pay me $500 for 2 classes, I'm going to go to the conference anyway, right? I'm paying to go
yeah,
to the conference. I'm paying to get a hotel to go to the conference. And if I can get there and if I can do that work and if I'm not paid my worth of what I think, and I think that I have 2 fees, right? I have a fee that I charge people inside EMS. I have a fee that I charge people outside EMS. But
and the second one is a lot larger, isn't it?
it is probably 5 figures, right?
Yeah.
But it took me years to get to that point. But I honed my skill at going to the Texas EMS conferences and speaking in Missouri and speaking in EMS Expo and EMS Today and all of those things, right? And one of the comments that I made was that we need to be able to look for the opportunities that come from speaking at conferences. Kelly, how many times have you spoken at a conference and someone has come up to you and say, will you come to my conference and speak?
A lot.
Right.
A lot.
Or how many opportunities have you had? And when I was in the consulting world where I would talk about community paramedicine, could you come to my EMS organization and help me set up a community paramedic program? Well, the same thing is true that when you go and speak at the Lions Club or the Rotary Club or the Knights of Columbus or what's the big one? The Chamber of Commerce.
Yeah.
You know what? These are going to lead to opportunities inside of organizations. And
Yeah.
I sit on the side that speakers speak. We need to hone our skills. We need to be able to tell a story. You don't tell a story without a point. You don't make a point without a story. And you look for the opportunities that will allow you to go outside of EMS and command 5 figures for your speaking
Yeah.
fees. And I think that that's more valuable.
I agree to disagree.
Please.
I agree. It's incumbent upon us, if we're charging money or if we're doing something professionally, and remember that professionalism doesn't come with a paycheck. If we're professionals at something, we have to do it right to the best of our ability, and if people are, using us in their advertising materials as a featured speaker, this or that, come see Kelly Grayson, come see Chris Cebollero, then damn it, you make it worth their time. and you make that advertising, worth the pimping that they do for you. And some people don't, some of our colleagues don't deliver on that promise, which is a sad thing. But at the same time, I look at this as this is a profession. I have been an EMS advocate with a fairly large platform for 30 years. And I did not take that lightly. But I expect to get paid for the product that I produce. And to me, the fact that it's not the money, it's the fact that someone appreciates, and places value on what you do. So
Hang on a second. Hang on a second. How about the student that's listening to you that is going to now use your guidance to become a better provider? Isn't that value to you?
Yes. Yes.
But you want the money too.
No. Yes. Yes, I do. I want the money. Like I said, I don't have to look. We were doing this last night at BarCon. If you don't know what BarCon is, at sci-fi and fantasy conferences, the official conference is all the panels and the discussions. BarCon is the unofficial conference that happens at the hotel bar where everybody's sitting around telling stories. And I live for that sort of thing, where it's an informal atmosphere and we just talk and I ask questions. And, hey, Kelly, what do you think about this? Or I've always wondered this thing. And we do that. And to me, that's valuable as well. And that's something extra that I'm going to bring because, some of our colleagues, they show up for their lectures and then they go off and do their thing, or they hole up in their hotel rooms and they don't socialize. But here's the thing. Once again, this is one of these things where they say, well, you're going to get great exposure. And our friend Reuben Farnsworth says people die from exposure. And that's true. You can't pay your rent with exposure bucks.
Right.
There was a time when exposure was valuable to me and I took that opportunity. But at the same time, even if I shouldn't have to pay for the privilege. And some of these conferences, you're paying for the privilege. I go in the hole in gas, airfare, lodging, time spent away from work. If I'm going to go speak at a conference, it shouldn't cost me $2,000 to speak at the conference. When they book you and you giving 2 lectures and they're 2 days apart, so you've got to, and they're paying you a flat rate of $600. And you got to pay for a hotel room and meals and airfare to Las Vegas to do that. I went $2,000 in the hole, and I've done that multiple times. I've spoken multiple times at both the national EMS conferences, and had good relationship with the people there, except for a bad relationship with one particular person who's no longer doing it. But I was able to limit my expenses in most of those by rooming with another instructor, or I stayed with Lou Jordan in Tawnytown when I'd go to the GEMS conference, cut my expenses a little bit. And something, when I go to the Texas EMS conference every year, I'm barely going to break even because they pay $500 a lecture. But there's a difference there. Texas EMS conference gave me my first shot. They treated me well. The people there like me and I like them. That's my tribe. So as long as there's a Texas EMS conference, Kelly will be speaking there. And I've been doing that for 20 years, even though, it's my vacation. But still, a professional gets paid.
Yeah, I think so. But there's payment other than money. And I think
that is true.
And I think that there's something that we have to be able to weigh. But if people are going to honor you and say, I don't apply to go to conferences, right? I mean, I apply to go to the national conferences because those are conferences that are picked blindly. But people call me and say, will you come speak at my conference? And I think that's just an honor when they do that. So if I'm investing in myself, and when you think about this from the standpoint of how are you growing your skill? Are you paying for an instructor methodology course? Are you paying for professional development, for personal development? To me, if I've got to take money out of my pocket to go speak at a conference, I am investing in my professional development because I am working on my skill, I am working on my craft, and I am trying to become better at what I do. But give us your final thought and let's get out of here.
Well, you know, if you are an EMS speaker, national EMS conferences are a great way to gain exposure and to build your following. It's up to you to decide what it's worth to you. I think that you should value your product and it has a monetary value. What that monetary value is up to you, and you decide what you're worth. But if you have the opportunity to speak at these conferences, give people their money's worth. And the conference organizers are not who you're having to please. It's the people who sit in your lecture every day. That's your audience,
Right.
regardless of what you're getting paid or not getting paid. Do your best for them. But that's my take on it. You've heard Chris's. We'd like to hear yours. Would you speak for free? Would you present for free at a conference if the exposure was good enough? What's your motivation? Do you think you need to get paid? We'd like to hear your thoughts at the show at ems1.com. And for myself and co-host Chris Cebollero, that magnanimous person who loves to do this for free, thanks for tuning in to Inside EMS. We're going to catch y'all next week.